Hi folks!
Howdy.
Welcome to Trust Bear again. I'm Jen Davis. This is Bear Davis, and we appreciate you being here. One of the questions that we get asked quite a bit is, what is the best Medicare plan? And our answer is that it's a lot more complicated than just a simple response. There are a lot of things you need to find out. Up here are some things we're going to talk about, some things that you should consider when you're trying to find the best Medicare plan for you. What is your current health insurance and how is it working for you now? What do you like about your health insurance? What would you change about your current health insurance if you could? Are you married? Do you have a spouse? If so, what happens to your spouse's health care if you go on Medicare? You should find that out. It could be really, really important. Do you have a doctor that you trust and want to keep? If so, that's a very big consideration when you're looking for a Medicare plan. Do you see any specialists that are important to you? You should know what plans your doctor accepts. Most doctors accept a lot of different plans. What is the least expensive plan that your doctor accepts? Do you know? Have you bothered to find out? Has anybody bothered even to ask? How important is autonomy when it comes to your health care? Do you want to be able to choose your own doctors from a network, including specialists, and be able to make appointments without referrals? That is still possible in some managed care plans. So that we want you to be aware that you have both options available in the Advantage Plan world. You have self-directed care, and then you have the plans that we hear a lot about in the media that are primary care directed, where you need referrals. But we just want you to explore your options and know that supplements are not the only game in town. What medications do you take? Are any of your specific medication concerns costs a concern? If so, get some help with that.
Do your homework.
Do your homework. Do you have any upcoming medical procedures? If you do, and there's a specific facility that you want to make sure you get to go to, make sure you investigate
Yeah,
that.
and those procedures may impact your decision, even just temporarily. You may want one solution to get your, to have these procedures, and then maybe switch
to
to a
have
different
access to a facility that's only included in a certain plan that costs a certain amount.
Like an eye
but
surgery
maybe after
or
you
something.
get that hip replaced, you're like, now I want to save some money and go pay.
Exactly.
So you can maybe
use the
switch that
system to your best advantage.
Right. All right. Let's see. What is your first impression of Medicare Advantage plans? What have you heard? There are many misconceptions about Advantage plans out there. We've actually heard them called disadvantage plans. And the result, we believe, is that people are spending more money than they need to in a lot of cases because they believe the concept of you get what you pay for. And that mentality makes them say, well, they don't really understand the financial dynamics that are at play with Advantage plans because somebody's making some money, otherwise they wouldn't have those plans. So they are an affordable option, and
there's an interesting dynamic here, Jen, too, where you mentioned Advantage plans. We talk to many people who are leaving employer insurance because they have to. They can't keep it after 65 for whatever reasons, and they're very negative. They just have negative comments about thoughts about Medicare Advantage plans, their perspective, but yet the Medicare Advantage plans are very similar to what they just are leaving with their employer, which they said they loved. So it doesn't make sense. There's a lot of miscommunication, misinformation, misunderstanding.
Also,
get the facts.
And Advantage plans are a newer concept.
Yes, they are.
Older people who have been on Medicare for years. We have a client in his 90s, one of the most wonderful people I've ever met in my whole life. Hi, Ernie. Anyway, he is in his 90s, and when people like that went on Medicare, supplements were the way to go, and employer plans. A lot of the time, those were
extended to Medicare beneficiaries. So the employer would pick up the 20%.
In the last decade,
secondary.
Yeah, in the last decade, the landscape has changed dramatically, and you should, if you've been on Medicare a while, you should re-look at it, and if you're just going on it, you should look at it with a fresh perspective. Get everybody's opinion, but then find out what's going on today.
Hey, thanks for letting me chime in there.
Absolutely. Hey, thanks for speaking up. I appreciate it. We think that you should think about whether you've heard good or bad things about any insurance company. Not that we're going to say any insurance company is good or bad, but it's good to know what you've heard because a lot of times what you've heard isn't even accurate. So we love to dispel myths, especially when they're not true. And ancillary benefits. One of the other things If these things are important to you, if a gym club membership's important to you, if over-the-counter supplies every month for free are important to you, if a little bit of money toward dental, vision, hearing, if that stuff matters to you a lot, transportation to and from a facility for some medical procedures or appointments, then you should really consider the options that you have, because these things do exist in the Medicare world. So choosing Medicare Solution, there is a lot to consider, but there's really only one thing that you need to ask yourself. And
That is trust Bear.
right,
We know Medicare.
right, trust Bear. Thank you.
Thanks for tuning in.